Prescription opioids or narcotics are a class of drugs that regulate pain and breathing. Drugs in this class include oxycodone, hydrocodone, morphine, and fentanyl, among others. Opioids are prescribed to relieve severe acute pain, similar to that experienced after an ACL surgery or a tibia fracture. Opioids are not intended to treat chronic pain like headaches or a sore back. These drugs can change the way our brain functions by targeting the brain's reward system. Over time, this may cause physical and psychological dependence or addiction. Once an opioid is taken, the chemicals dopamine and norepinephrine are released in the brain and attach to dopamine receptors. This release of dopamine can produce a euphoric effect or pleasant feeling, comparable to eating something highly enjoyable, because these actions activate reward centers in the brain the same way. After consistent opioid use and associated dopamine response, users may develop a tolerance to the drug, requiring more to produce the same euphoric effect as before. As tolerance builds, an opioid user may become dependent as the body adapts to the consistent presence of the drug. Once a user becomes dependent and has stopped using, symptoms of withdrawal like vomiting, anxiety, and sleep problems may appear. To avoid unpleasant symptoms of withdrawal, opioid users often get trapped in a repetitive cycle of drug use. Higher dosage and more frequent intake increases the risk of short-term and long-term side effects. Slowed breathing is the most common side effect that leads to death in an overdose situation. Other side effects include slowed reaction time, nausea, lowered testosterone levels, and drowsiness. In fact, in 2016, 116 people died every day from opioid-related overdoses. Sometimes opioid misuse is the beginning of this dangerous journey. Misuse is when an opioid is taken outside of the prescribed parameters or without a prescription. An athlete may be misusing opioids if they are taking more pills than prescribed in one sitting, or taking pills more frequently, such as every 2 hours instead of every 6 as prescribed. Also, trading pills or stealing pills from a teammate, or the athlete noticeably pulling their focus away from their team or treatment plan are among other signs of misuse. Repeatedly misusing opioids may lead to opioid addiction. Opioid addiction can occur in as little as 7 days after initial use, even for those under a physician's care. If you or a teammate is struggling with opioid addiction or misuse, it is advised that you seek help from a member of your sports medicine team, or call the Substance Abuse and Mental Health Services National Helpline, or First Call. To learn more about prescription medications and their impact on sport, please visit Drug Free Sport Access at dfsaccess.com.